So you have the base, the apex. The coronary sulcus is the depression right in here. The anterior ventricular sulcus is the depression here. Posterior ventricular sulcus is the depression on the back side. The epicardium would be the lining that covers the outside of the heart. You don't see it on the models, but it's directly in contact with the exterior. The myocardium is the fleshy inside, the meat of the heart. The endocardium is the lining that lines the interior ventricles of the heart. The trabecular carne is the meaty flesh of the heart, the little ridges that you would see in here. The left and right atria you are going to see in over here would be your right atria. Over here would be your left atria. Your right and left auricles are the little ears here. So your right auricle, your left auricle. Your ventricles are down in here, so your right ventricle and your left ventricle. You can notice the left ventricle because the meat of it will be a lot thicker on the left-hand side. Interventricular septum isn't labeled on the model, but it's this division here that goes through the entire heart, front to back. And the moderator band is actually seen on the plasticized heart, but it's a band that would actually just connect these two, and that would be the moderator band. The anterior ventricular valves, on the right side you're going to have the tricuspid, so 1, 2, and 3 on the right. On the left side you're going to have the bicuspid, or the mitral valve. And those are your atrioventricular valves, AV valves. The chordae tendineae are these little fibers here that connect to the papillary muscles, which connect to the ventricular wall. The semilunar valves are seen in here. So you have your pulmonary semilunar valve that goes into the pulmonary trunk. And then you have your aortic semilunar valve right in there, and it goes up into the aorta. So yeah, this is your aorta here. Some of the vessels that we need to know are your superior vena cava, your inferior vena cava. The pulmonary trunk is right here. The pulmonary veins are right over here. So pulmonary trunk, pulmonary veins, not sure why they're red. The aorta, it's this lovely red piece right here. And some of the major arteries that we need to know are the right and left coronary artery. So over here you have the right coronary artery coming off of the aorta. On the left-hand side, your left coronary artery, so it's kind of flopped. Your left coronary artery here, and it branches off in 2 divisions. The top one right here is your circumflex. And then down here where it branches off is your anterior interventricular artery. Circumflex, anterior interventricular artery. Coronary sinus, if you flip the heart around, turn it upside down. Here is your coronary sinus, this section here from the inferior vena cava to about right here. It's coronary sinus. And that is the Peter Max heart.